How many people do we have on tonight, Julie?
We are recording.
Okay, thank you. Thank you, everyone, for coming tonight. Deeply appreciate you taking this time out in your summer. We have a lot to go over. Real quick, though, before we start, let's do some introductions. I'm Lisa Gorley, Chair of the Community Health Committee. We'll go on around, and Julie, go ahead and even introduce yourself.
I'm Julie Fisher, the Administrative Assistant.
John Morgan, Police Service Officer of the Police Department. Larry Horton, a member of the Health Committee.
Shirley Bird, the Family Assistant.
Brock Byers with Family Assistance and Resource Center.
Want to introduce yourself?
James.
James Page, Project Coordinator for Samaritan Health,
Just,
Rural Outreach Grant.
just in time.
Glad to have you, James. Go ahead.
Victor, President.
And then those behind you.
Lonnie Victor, three-home resident.
And who's behind you, Josh? Thank you.
Jeff Lynn, Police Department.
Your turn.
And Bob Dalton on the Health Committee and Parks Board.
And Dick?
And Dick Knowles, community member of the committee.
And Brandon, you're conducting or are you sitting in?
I am watching just to make sure nobody needed anything, but I'm Brandon, Finance Director.
Thank you. I just want to make sure everybody knew who was here. So with that, we have minutes that everybody has in front of them. Are there any changes? Everybody okay with them? Give you a minute. And we would entertain. Did you need some, Rock?
No.
Okay. Then we would entertain a motion to accept the minutes.
I'll make a motion to pass the minutes as.
Okay, do we have a second?
Second.
We have a first and a second. Any discussion? Okay, seeing no discussion, all those in favor, say aye.
Aye.
Anybody opposed, say nay. Motion passes. Thank you. That brings us to the Community Health Fair Committee. And I believe Mr. Knowles has something to report.
Well, I was just going to chime in to say that I think all of the vendors have been contacted. I'm not sure, Bob, that we got everyone, but pretty much everyone has been contacted. And I'm up to number 6 of people being very supportive of the decision to not hold the fair, and also being pleased with how this has gone in the last couple of years and looking forward to next year. I just kind of wanted to share it with the group. I think we have made an impression. So Bob and I will keep working on it.
Thank you. Do we have any questions? Well, I look forward to having it again. Only solid positive feedback from the event you guys hold. So we were going to have someone report on the Christmas committee, and so nobody's here to do that. Do you have anything, Larry, you'd like to say on that?
I don't have anything to report on it. Jim was at that meeting and I was not, so.
Okay.
Or-
Percolating right along.
If I can just jump in,
Yes.
just let people know that on the 7th of August, we're having a works party to clean and work on the Christmas cards that go around town. So they'll be painting some new cards, cleaning and repairing the cards that we currently have, hoping to have more and a better product next year. That's August 7th at 9 a.m. right behind City Hall.
And
Perfect.
since you refresh my memory a little bit, we also, I think we have a donation of 28 sheets of plywood. 3 of them to help build a Santa Claus sleigh and 25 of them for new cards. And we are encouraging anyone in the community that has some artistic ability to join us and help us paint some new signs, as well as doctor up and make the old ones beautiful. So
That's so exciting.
thanks, Jeff, for.
That's very exciting. Okay, so Is there anything on the Western University project?
They're all on vacation for the summer, so
Good
as
job.
far as I know, they are planning on running their program with, in conjunction with the high school health program. And it's very exciting, so I'll look forward to giving you a better report in September once they get started.
Okay, thank you.
And if I might, I don't want to step on Larry's toes.
No, go ahead.
I just wanted to remind people, I actually sent out a flyer. It's actually the university in conjunction with some folks in Lebanon are doing what they call a Health Solutions Summit. They did one last year. It's on the 20th of August. And signups, just to remind people, are actually, I think signups start tomorrow, registration. It's a virtual event, a full one-day event. They're offering, well, I'll let you do the registration and it's a little clearer, but just to remind folks.
Okay. Anybody have any questions about anything we've covered so far? Okay, good news. So that brings us to the Homeless Action Committee.
And that's me. So I've invited Brock and Shirley to come and speak to us tonight. We've been working on a lot of different aspects of the project, trying to come up with a operations manual that will be acceptable and something that can be presented to the city council for their input. And so I guess basically I would turn it over. I guess Brock's probably going to be the main speaker. So I'll let Brock take it from here.
Good evening, my name is Brock Byers. I'm the program manager for Family Assistance and Resource Center Group, and I'm helping facilitate what we call the sleep center or that type of action. I wanted to provide a little bit more of an update as to kind of where we are. We wanted to be a little bit further along. We did get a request from a couple of the council members or the committee members here to summarize and provide some additional details to what was missing last time. So some of the things we're providing is an overall budget. And this is a little tricky since we don't really have the piece of property, but we're going with the assumptions that we have. We did go and get a proposal from Lit Industries, which does basically a community in a box type dynamic. And that would be what I would consider, usually when I do these type of quotes, I'll do a good, better, best. And so that is one of the best type dynamics. That is one that has comprehensive kitchens, bathroom facilities, shower facilities, laundry, kind of in a box. It's one of these where you can go with a cargo container, and these units can actually be deployed in about 45 minutes. And so we're in conversation with that group. We're also in conversation with our grant writers and what dollars are available to folks. So one of the requests was a budget. And so it's a little difficult still to frame the budget aspect. So I'm going to end up framing a range based on the quantities that we at least prescribe to. So we're starting with the idea of a 30 unit type dynamic. And what does that budget look like? Again, when we met with a few folks, there is, we'll be meeting with a finance officer that helps nonprofits with that and has done projects like the Ashland Hotel project. They've done the Corvallis project and such. So we want to do this correctly and do it well. So we'll have a budget also included in that dynamic. And the other piece is a summarization of the policies manual. As I kind of described, I know it says family assistance in that manual a lot. And what that has to do is that has to do with the intake aspect, because a lot of our work is intake and assessment. So an individual comes to us, we have to have an intake process and an assessment process of what is it that we're providing them? Because for us, we're not just doing the sleep center. we're providing other services. Do they need an ID? Do they need mailbox? What is it they really need as individuals? A lot of that detailed process of about 80 pages has to do more with that. So contained within that is procedures that we would do, but one of the requests from the member was, can we summarize what kind of the process of the sleep center? So I'm putting together process steps from intake to what does it look like if we have a successful candidate going through sleep center to transitional to permanent type housing dynamic. That's about where I'm at with that. As kind of what I call sidebars, as activities I've also looked at is we have issues with jobs in this community, and we have issues with transitional housing in the standpoint of trying to solve those particular issues for individuals. One is, we have all these people in the need of transitional housing. Where are they at on the list? And I'm hearing the list is, what did I hear? 2 years out or some crazy number. Regardless, there's a fairly substantial need in this community. So while we're working on this low barrier type solution, we're also, FAC is working through the transitional housing portion as well as partners. Where are we at with various partners? In the last 2 weeks, we've met with CSC, we've met with, the vendor partners of these things. I'm trying to think, did we meet with Samaritan? I can't remember some of the. Anyway, so we have various partners. We're still that are instrumental in this particular project. We did, through a lot of help from Dr. Horton here, we did make another application for a smaller grant. It was a $30,000 grant. 2 weeks ago, I also submitted for a $150,000 grant for operations of this facility, should we get everything fall into place. And then through our conversations, it looks like there may be some funding or monies for the type of operations we're looking at as a community, as a municipality, some other things. So our grant writers are grant writers that were very successful in helping Albany acquire their multi-million-dollar grants and so on and so forth. So we're pretty optimistic after meeting with them that there may be additional funding, because that is a piece that's still kind of missing from all this, is what is that breakdown look like? Certainly family assistance, we're looking at running a facility, we're looking at some operating funds, but we're just a small organization with, a grant that we have this year. The grant we've applied for does not activate till 2022. We did receive a United Way funding grant last week, and so we continually work on finances and monies. But again, this project is going to be to do it correctly and to do it in the manner which I think this community has asked for. It will require needed additional funds and stuff. And we're going to try to gauge, here's the grants we have lined up. Now, there may or may not be a guarantee of that, and pending, whether we get those things or not, could say, how do we deploy? The other piece that we're looking at is in our structure. For the organizational structure, is Family Assistance and Resource Board is a certified nonprofit. We have a board of 5 directors. Now, one of my concerns is we need a sub-board, almost like this health committee is to the city council, a entity that is sweet home focused, sweet home administered in a sense, and members from the community, so that we can get the input, we can get the desires in a sense, because I have lots of ideas of how to deploy this, but I'm not even from this area. And I think it would be best suited that this community kind of own that aspect. So we are forming, we're going to be changing our bylaws, or the plan is to change our bylaws. Until they vote on it, I don't know. But the idea is to change the bylaws to add another 7-person subcommittee that is led and managed. This facility, in a sense, is overseen and managed by that committee as well. So some of the rules and aspects can be tailored to this community specifically. And that way we can be sure that we're hearing you and that we're, administering the policies and requirements that this community wants to administer. So for example, I watch the Facebook and such, and I get well, you build it, they'll come. And my first initial response is, that's nonsense. If you talk to every city, every community that has built these, they haven't seen that. Now, as a second point of defense, we're building what we call 30 units is what we've framed this. I'm here to tell you, you have more than 30 chronically homeless clients in this community. So we aren't even satisfying your needs for this community. So we had 44 actually for your point in time count for even this community. So we're in fact substantially short. But we also set forth the desire of a 60-day residency requirement. And certainly there may be exceptions to that, but we're not going to get, I believe, the influx of communities and all this. We are also taken steps to have conversations. So for instance, we met with the mayor of Albany today to discuss this very issue of what are you doing in your community? How do we work together? And he's telling me some really amazing things that the mayor's council, he's meeting with the mayor of Sweet Home, he meets with the mayor of Lebanon, and together he feels we can also form better solutions for this particular contingent of individuals and stuff. I guess I'm pretty open to whatever questions, criticisms, concerns, anything that anybody would like to bring up.
Okay, so we'll go to the committee first. I would like everybody to be able to ask questions, but we'll do the committee first. Anybody have any questions? There seems to be, because I was watching Facebook too, there seems to be a little bit of confusion for people as to where this is going to transpire.
Mm-hmm.
And so when I'm thinking about this, I'm thinking about the infrastructure.
Mhm.
And so maybe that's too far into the weeds yet.
Mhm.
Where we're going to put our pipes, where is it going to be run from? Are we going to be able to put a barrier? I want to tell the audience that my friend just went through this, and there's a big hullabaloo in the community, and they were all upset, and they put in a very nice facility that looks great, absolutely looks great. Their only complaint was that it was too close to a school.
Right.
And so all of their concerns dissipated, and it's been fine.
Yeah, so we're looking at what they call the Tomahawk property, which is, but it's kind of borders the back end of the railroad that goes along there. The mill property on the other side is the mill property. This is actually, I guess, was possible part of the mill property, but it's on the south side. It kind of is the back end of Bimart. It also goes to the back end of the maintenance? Sweet Home maintenance facility, vehicle facility. I don't know what it's a maintenance building there. What we envision is a single entrance coming in and out. You do have to have dual entrances just for safety reasons, but the idea is you have a single entrance. As far as the barrier, there will be a barrier fence. Depending on which group, if we look at the best solution, they show it's almost like a LEEDS type project, and LEEDS has to do with environmental, and it has to do with is it energy efficient and things like that. You can go from one end of the spectrum, but it is fenced in. It does require check-in. It is managed, 24-hour managed. It does have camera security. Boy, I don't know. It doesn't really, the facility is a sleep center. It's not a shelter. And we want to kind of dispel that idea, because what we're really trying to do is provide a mechanism to, one, there is the Martin versus Boise federal case that people know about, and people have a right to rest. And so it's created some issues with cities on how do you enforce things like vagrancy? How do you enforce? So I actually have some pictures I'm going to be including in our presentation for the council, but I took pictures of a fellow that is out here camping in his trailer and has his boat and has his boat vehicles that you're here simply to go play on the lake. They aren't homeless. They're there, but our law enforcement has no ability to really take some action. They can question, they can do things. All they have to do is go, hey, I'm homeless, and play the game. So this provides cities some mechanisms to deal with that. It provides them the ability to get them out of neighborhoods and downtowns and into a consolidated location that we can provide services and have services be provided to them as well. But it is fenced in. It does require check-in. There are guest hours, but it does require guests to check in and check out. So there isn't this sleepover thing and that. It really is a managed action or activity. It's not a homeless camp that happens to be in a location. It is a sleep center for which we offer these types of services.
Okay, so we have a question. Go ahead.
I may have missed it some other time, and there's a lot of information in here, and I'm trying to look through it as quickly as I could, but is it a wet shelter or a dry shelter?
It is a low barrier shelter, and low barrier can mean a lot of things. So in the case of low barrier, some people have animals. That could be considered a barrier. They could have alcohol and drug issues. That could be considered a barrier.
Right. I mean, specifically, are people who are under the influence of intoxicants allowed in the facility or not?
Absolutely, they could be. Are they allowed to use any intoxicants or weapons or things like that? Absolutely not.
So you can't use on the facility, but
Nope.
if they come in under the influence, then that's kind of.
It's a low barrier facility.
Okay.
They can be searched.
Yes.
By sleeping there, they're allowing searches of your.
Yeah. And so the idea behind that is we would have cases, so things even like, I think we were even discussing even prescription medicine really could be under consideration. Our clients will have lockers, and you lock that stuff up in lockers. Because it's not, using on site is not tolerated. It's illegal. So, I mean, we're not going to sit there and go, oh, I don't see it. I mean,
If they do use them, let them back out, and we still have the same homeless that are.
well, there was, we're modeling a lot after the sleep center in Walla Walla, and there are, they have various actions. You do take action. You write up an action report. That action report can be everything. We've talked about the conversation of where you have a sleep center hut, a nicer hut, and you may get booted out to the tents. You may trespass that individual. So if they're blatantly causing harm to themselves, others, things like that, we have no problem at all calling the police in. We can trespass them.
Okay, but then what does that just put them back into the community, which is,
Well, but that's the interesting thing about it. One, they're already in the community now.
Yeah.
But the other piece of it is by providing a center, guess what? Your municipality now has some other actions and things that are available to them that isn't if we don't have a facility for them.
And then you're talking about 30 units. Are those individual units?
Those are individual units. We're also looking at, so there's kind of the good, better, best proposal, and that's where the community is going to have to really decide. So we are looking at 30 individual, the best ones that I was looking at recently, they're basically 8x8 units. They have 1 to 2 beds in them. There's a dynamic around that, but there was also the ancillary things. So one of the things that we did, we actually purchased a shower trailer. So you may have seen it over by the church. We actually need to outfit it and get it set up. That is a mobile shower trailer, but there is also the dynamic of, a common eating area and cooking area. There's the laundry facilities. Eventually, maybe there's restrooms. They have methods for providing that, but we need to decide,
you know, where's our budget points, where's our price points?
Would it be more cost effective to do like 3 like large pole barn style, something like that, where you can put lots of rooms all in one unit and have facilities all for each one, and you can have one for families, one for men, one for women or something?
Yeah, we've seen that dynamic.
It's like, you're only having to put in a couple of facilities when you're still keeping,
Mm-hmm,
and be cost effective and not being a tent city.
mm-hmm, absolutely,
Something- I mean,
yeah.
I'm just wondering if. one
Well,
of the-
we're not gonna try to do, the tent is, so it was 30 of the units, the Conestoga or the pallet, you've heard of pallet homes. There's also these LIT units, which is, I'm super in favor of, because they have environmental, they build essentially with 8 bolts on each corner. They can be put up in 45 minutes. They can be dismantled in 45 minutes. I think that's still under conversation and discussion. While we can frame what we kind of like this solution to be, it's from this end of the spectrum to this end. I would love it to be at this end, but it's based on financial. There are lots of options. The family piece, we are not, at least in our proposal, dealing with the family piece. We have conversations with partners like the Hope Center that is dealing with families, but we don't want children, because we're also low barrier, in that environment. Now, when you talk about families, the interesting thing is families can be 2 individuals or more, and a lot of them consider themselves family, even if they're not spouses and things like that. So we want to encourage the ideal of a family, but the reality is there can't be children on this particular site.
So within the good, better, best scenario, is any one of those scenarios staffed 24/7, or how is the case management done? And
Yeah, so we're planning to implement case management regardless. That's an FAC our emphasis is street outreach. We're the ones with the little van that drives around and so on and so forth. And our emphasis is to get people what we call emergency supplies. I mean, just life supplies, water, food, hygiene. And we were pretty instrumental in COVID, and we hope to have some of that claim. We didn't have a single client catch COVID. But yeah, around that dynamic, our ideal is to staff at 724, but if in each of our scenarios, so the low end range still has the ideal of 30 facilities. So if we go with something like the Conestoga, which are without donations, it's about $1,300 to build. I don't have a picture here with me, but I could, there was in the presentation. They're 8 by 13. They look like Conestoga wagons. And they, when we talk with Walla Walla, at least they have some that are at least 4 years old and look as good as the day they were there. They do go through a few doors because people break doors for various reasons. And so they said from a maintenance wise, they've had to replace some windows, replace some doors and those aspects, but in general, you mentioned a little bit about budget and the aspect, and really the major cost of this operation is going to be, believe it or not, when you have your staffing a minimum of 2 people, 24 hours a day, that's really 2 times, what is that? 3 sets of people. That's really 6 FTE per day. And if you take 6 FTE, 6 people per day times 365 days, you come into hundreds of thousands of dollars. So that is what the cost is. And that's the piece that we're, working so hard to get you grants and get grants and obtain grants for the staffing, the case management. There'll be a lot of partner interactions. So, our intent is to have the Samaritan bus come. We would love to figure out how to work on adherence to medications and help clients with medications. Because if they're on their medications, things go much smoother. Getting IDs and, just providing those minimum things that we think people should have in order to move forward on their lives and such.
That's one of my biggest questions. It's a little contradictory as far as like, they're gonna have to provide residency because they have to be able to be home resident. However, you could also say that that's something a piece that you're gonna help them do.
Mhm.
Like, to help them get an ID. So how do you provide residency without having an ID? And how do we know that, we're just, and I know that you said
Yeah.
that I travel for work.
Mhm.
I see that like, oh, here's the new spot because here's where they're going. Like, I mean.
Yeah.
So unfortunately, I feel like that, not really the case. We're not going to have an influx.
Well, I think they'll try to be the influx. Now, a lot of it was because we are kind of the face of outreach. We are the connector. We kind of know who's here and who's not. And then where there isn't, there is kind of sense that residency requirement. It does get tougher without ID, without proof of mail, without all kinds of things. This is again where there is absolutely an exception process. We talked a little bit about that because we had an instance this last year with the winter shelter. It was a dynamic. Single mom, 5-year-old boy, dropped off because her and her boyfriend had a fight. And are you going to really leave these two individuals to try to figure out? And so there is, an exception to everything. And I think that this committee, this 7-person quote, it's really a board for this specific thing. We'll figure out rules of engagement for that. But as I say, life, there's always some aspects to that. But the intent, though, is really we don't want all of a sudden everybody going, hey, everybody. And we've already shown that when we did our point in time counts, our organization went out even during COVID. We did what they call point in time. We went out and counted how many homeless do you have? How many houseless? And it's kind of a curious number. So we found what I call chronically homeless. These are the folks living in their cars, motor homes. There were about 44. But go talk to the school district. There are over 300 individuals in this school district that are houseless. Now, is this a solution for them? It could be, right? We can't because of the children, but there are other individuals and stuff. I guess that doesn't quite make that illustration. But I guess the point is that I think there's a lot more houseless-like individuals here besides what our chronically homeless are.
Have you looked into like Medicaid billing as far as the case manager positions are concerned? Because I mean, as you're saying, right, the biggest barrier here really is not the brick and mortar or the facilities, it's the staffing. And when we look at the population that's out here as far as the chronically homeless, I mean, they also have an extreme high acuity in regards to health issues and substance use disorders and all, across the board, right? Mental health issues being another thing. So to me, it's like case management, is the most integral part of this in terms of if you're trying to take people from point A to point B and so on and so forth, right?
He's my straight man, by the way. Interesting you say that. Shirley is getting certified as a case social worker. Is that what it's called? Case
Community health worker.
community health worker.
Community health worker also.
Right.
Okay.
And so we're taking steps to address that very specific issue because that's kind of the underlying premise of a lot of this is, to be honest with you, it has a lot to do with trauma and people's trauma, and people deal with trauma in various ways. I actually have a photograph of a guy with his air cooker because he just lost his job. He just lost his girlfriend and he's homeless and doesn't even know what to do. An interesting statistic, 60%, this is a US statistic, 60% of Americans are one paycheck away from being homeless or houseless, which is interesting because when you take that figure and then you look at Oregon from the state of homelessness, and I think we're number 4 in the country for homelessness. So you take that, 60%, you go, wow, that may not be really the number. We may be closer to that. And that's a really sad fact. The other thing is, I think this could possibly provide resources in the case of like we experienced with the fires. How many people were suddenly instantly homeless because of that? Now we were servicing people out in the parking lots of Walmart, and here we were, working, I guess Lynn County opened up and there were aspects of that, but this, it's 30 units.
How many people are housed in each unit?
Well, currently it would be singles, but there is the opportunity you could put 2 in some of those.
I would think it would be more beneficial. Yeah.
Right. Oh, I would love to. I mean, if you look at the shelter dynamic, I mean, you can put within 3 feet beds there's some rules and guidelines for that. And from a cost efficiency standpoint, that would be great.
As far as like a permanent thing
until we hit COVID again, and then all of a sudden it gets wonky. But yeah, absolutely, where we can derive efficiencies, we absolutely should.
Well, and
We're in
you-
favor of that too, by the way.
I believe last time you came, you spoke about people who are living in their cars, that
Mhm.
kind of thing. Instead of being up in the neighborhoods, they now have access to a toilet and shower and a place to have their mail sent so they can get a job.
Right.
But even those who are working and homeless, being able to eat and get dressed and do their laundry, that's just way off the chart for people who are homeless. And to be able to keep that job is a big thing. And to be able to do this type of facility, we're going to be catching all different kinds of people at all different stages.
I think so. I think we will see a different dynamic as people feel better. If you look at, say, the men that are out there, most of them, believe it or not, you don't see many of them. They hide out. There's trauma and they're embarrassed. They're the provider and yet they can't provide, and a lot of them hide out. So, we may see differences. We get people, like you said, we had a couple last year in a motorhome running out of funds, got a job, unfortunately jobs in Salem, and they were using all their money for gas. So there can be, some other aspects and benefits, I think, as well as what we saw with the winter shelter is a little bit different dynamic. So when we closed the winter shelter, it's been a little bit of a challenge for us to go, okay, where's everybody hanging out now? So at our high point at the winter shelter, we had what we call contacts. We had 34 individuals come up and get water and get socks and get blankets and things like that. Now, that dynamics changed to, 5 or 6 at a time. Sometimes we have this person, sometimes this person's not available. It's a lot tougher to provide people services. If we have a consolidation point, then everybody as a community can work together, as he pointed out, and really perform what they call case management. What is a solution for you or you or you? And each solution may be a little different and tailored for that individual.
So the hard question is longevity. Do we have access to enough grants and things to help us keep this viable?
Boy, that is a good question. And in these grants, they talk a lot about what they call sustainability, because they don't want to give you money if they think you're going to use it. And that's it, everybody. We're working hard on that. We're taking steps. Unfortunately, a lot of our grants don't activate till 2021. We are seeing some of the benefits of the grants we applied for last year. I mean, the United Way grant was a bit of a surprise to us, like, whoa, where did this come from? In talking with our grant writers, so our grant writers were graciously provided to us by the county. These are like the best of the best. These are $150 an hour grant writers. And I was pretty excited to hear from our meeting at the closure that they go, yeah. And when I told them, oh, I might need $1 million over here, they go, yeah, I think I can help you with that. And so while optimistic, I do believe we're all going to have to work together as a community to provide solutions. And money isn't the only piece of it. I do have a concern for expertise. So we're training Shirley. We have another individual. We're going to be doing what they call health navigator training. We need to make sure that not only do we, can financially pay wages and do things like that, but we have to be able to provide the expertise. So I started asking a little bit about some operations in Eugene. Holy cow, you take a look at their volunteer intake form. Yeah, when did you get your last PhD? What degree do you have? What behavioral health aspects are you focused on? So they are looking for those type of aspects. Now, it may be a little advanced for us yet, but those are things that we could and should probably keep our eye on. And, we got to take baby steps, but let's see, if I was to put a percentage on it, I would say FAC is providing funding up to this year. I mean, we got a grant. We are in fact dedicating. We're dedicating, training the individuals. We're dedicating our shower trailer. We're dedicating assets. And so we're involved in it. Is that enough? No, but Dr. Larry Horton here has also been talking with people. And, there is a lot of possibility and potential. But until we really secure that piece of property and take the next steps forward of getting the committee together and taking the next steps forward, are we doing Conestoga where we need to, to do 30 shelters is what is that, about $50,000? Are we going to go for, $10,000, but these babies have air, they have, all the whistles and bells and everything else. And we're providing a community center and a community rather than a sleep center. Again, that's, we can go to both ends of the spectrum. I think there's a happy medium somewhere, but,
Shouldn't even have air in my house, so.
Yeah.
I agree.
Because they're actually, with the tenant landlord law, I think they're heading in the direction of making it mandatory for landlords. With the 71 people that died over the.
Yeah, and I'm not sure we fall under landlord tenant. It gets a little interesting there. But absolutely, we need to conform to the laws and regulations. So when you spoke of excavation and development, we need to make some decisions. Are these, you go to the Conestoga aspect, there is no power. We could probably put some solar units in to do things like phone charging units or things like that. To everywhere to, if we are going to provide bathrooms, what kind of bathrooms and such, is it a porta potty or is it, a facility that requires power and water? And we're going to have to figure out what does our budget allow and, how do we raise that and how do we do that? So there's still a few, gazachas in there.
So, in this packet you gave us, is there phases we need to do, infrastructure?
Yeah,
that kind
I've
of
been
stuff?
talking with Shirley a little bit about that, and that was her concern, because as I mentioned, it's a couple $100,000 to staff 7 to 24 an operation, and you're going, well, if that's for five huts, that's not a good use of funds. It's not a good use, and so I don't know where that cutoff is, and we probably need to identify that cutoff for you. We're going for the 30 and then, the RV and the car and the tent thing aspect, but
The
I
grant,
certainly has some opinions on it. But
the grant that I worked on was strictly for the infrastructure. And I basically asked for $30,000 because that's the maximum that they would give. It was an Oregon Community Foundation grant.
Mhm.
And that's a $30,000 grant, which would, I think, get us down the road towards water and electricity. I don't know about sewer.
I think it depends on how close the
Well,
sewer
the maintenance
system is located in the
facility
maintenance
must have
facility.
electricity and water. It has to have, and that's right there, the property lines.
And they'd also know if there's
Share.
anything under that road.
Yeah.
We actually need to talk to them and find out. So that we could
Absolutely.
have an idea of what that would cost to provide toilets and showers on site. and
Yeah, I
electricity.
did check into we were looking at possibly moving a building and looked into move expenses, but as I kind of, I'm kind of on both sides on this. I would love to create a master plan. We do need to create a master plan, but the reality is, I have really a job with FAC and we do these things and we have a lot of other projects we're working on. And while I'd like to spend a lot of energy on that, until we really have the property and really, it's kind of like, yeah, the check's in the mail. I can get, kind of this, and I can kind of gauge what things cost because of my past and background. But the reality is, like you said, let's say we're able to tap into existing, or do we have to now run new power? I don't really have that. And we might be able to better provide it in the range guesstimate, but I personally don't want to spend too much energy in that space if for some reason the community decided to change their minds, if the We're unable to negotiate with the county for that piece of property. There's a lot of kind of wheels spinning here. So where I'm trying to spin all the plates up I can for the things that I do think are important. And, you know, I think your question's a very valid one, at least if we can get some ideas of ranges and such. I have no idea. I'm not a developer, so.
Why, I mean, why 30 units, I guess?
Kind of how we came to that is we knew our pit and time count was about 44. And we said, well, what happens if we take 10 to 20, 10 to 20% off of that? Because you do have transient, you have people incarcerated, you have people in healthcare situations, so on and so forth. So you do have a little bit of, things breathe a little, and it felt like an okay number. What we tried to bound it with was actually the idea of 50. So there's 30 of the hut-like units. There's about 15 to 20 of these tent-like units. There's 10 of the RV and maybe 5 or so car camper types. The RV and car camping was supposed to be single day. I mean, each day, we don't want to set up a campground. We don't want to set up a mechanism for people to just go, hey, and there are valid reasons why people do, but we are saying you've got to apply each day for those type of things. The tent piece is because, we kind of needed a mechanism to, if you behave, you're here. If you don't behave, you're here. And if you don't behave there, you're trespassed.
Incentive based.
It kind of is that. And so we were looking at a dynamic around 50-ish.
For me, it's just 30 is a lot. And like you're saying with the case management piece, it's enormous, right? And so.
And why do you?
It's enormous.
Why do you say that?
Funding case management for 30 people versus, say 10 or something like that, right? Where it would be
enormous. I guess what is your underlying assumption on enormous? Enormous to me, when I dealt with HP, is I wouldn't touch anything under $50 million. So enormous, what do you mean by enormous?
Paying 6 FTE. I'm talking about the cost.
Yes, that is.
And being grant funded and being in a position where you want the facility and then, to kind of further the exploration into continued funding, it's a difficult position to be in with grants, right? Because you can never really tell what you're going to get. And if you already have something in place, it's a little bit harder to ask for certain grants because you already have this thing. Usually grants are because I want to do this thing, not because I already have it and I can't pay for it.
Yeah.
And so when I look at 30 units versus 10 or something to that effect, which would be much more manageable and seem a lot easier for community partners to come in.
Well, I still have to have 6 for 10 because I'm providing 724 support. That's 2 people each shift.
If you could get to a place where you're providing 1 per shift, if you have 10 units.
We can't do 1 per shift because you have a safety factor. We always have 2 up in our organization, just from that aspect. That's why I chose 6 as a bare minimum. Okay. As far as case management, they may or may not even be case managers. You're correct on that. Okay. I think the ratio rate is it 1 to 10-ish or something like that. It just depends how good your case manager is. I believe a new case manager is about 1 to 10 clients. I don't know. If you're really good, you might be able to handle 30 with 1. It depends on their case.
Depends what you're doing, right?
But yeah, the 6 was chosen because we, as a requirement of our organization, the safety of our workers, 2 up always. Sorry.
Well, and I'm thinking about the community court process where a bunch of providers have came in and showed up and participated in that one day, 1 time a month thing, which is a lot less of an ask. But when we look at Lynn and Benton County or Exodus or these other providers who are dealing with mental health and these kinds of things,
absolutely,
with them incorporating them into that structure, right, is what you're talking about when you're talking about bringing the community in. And so if you have a panel or a caseload of 10 versus 30, it's, I just wonder why 30, you know what I mean? I understand.
The 30 was how many clients? So if you have 44 clients out there on the streets and we provide 30, there's some hiding and just don't even want to participate in the facility or whatever reason.
Exactly.
We're barely meeting the need really for this community. And that's what we kind of saw it as. It could be probably less. It could be more. I don't know.
Right.
I think.
It's just, I feel for you.
And what also isn't noted, when we talked with Walla Walla, to be all out fair, the 6 FTE is 6 FTE. Their volunteer rate is actually quite high. So they only staff, gosh, what was it? Midday to late evening. And believe it or not, their police department, in their case, their city polices in the, I think it's from 10 to 6 a.m. or some number there. So they have volunteers, they have paid people, and then they have the others. So if you looked at the cost that I'm looking at funding versus the realities, I think we're going to get a big onslaught of volunteers. And then you go, well, maybe it is one person paid with a community volunteer.
What would be the, I guess, the goal in terms of length of stay for someone in that facility? As far as, are you looking at like within a year, we're hoping, or is there any, I mean, I'm not looking for specific, you have to be out on the 31st kind of situation, but as far as goals in that case management, how long are you anticipating someone staying?
So in our particular case, we have not established a goal. When we talked with Walla Walla, they don't have a goal. They have a person that's lived there for 2 years, goes to work, is a great citizen. They actually participate in some of the operations of that facility. So they get some benefit of that.
Kind of like helping hands.
We were looking at a model similar to that. With that said, there is always the goal, at least with our operation, is we want to, I mean, the ultimate goal is we would love to go, here's your emergency housing. Oh, by the way, here's your transitional housing. We have 7 acres. Let's put another community unit there, and here's your transitional housing. It's not the $200,000 houses over here that we're allowing the developers. Well, as long as they do 10% low income housing. No, here's 50 units that we can put out there, and it's transitional. Then here's the permanent. And, our goal would be hopefully, less than a year, we get them through the whole stage. Reality, I don't know. I'm not sure what the real success rates. I've heard some programs that are fairly successful. There's not many that are successful from where we are here. We have individuals that have been chronically homeless for 30 plus years to permanent housing.
Right.
So the reality is, I think we'll have some individuals that from behavioral standpoints, mental illness, things like that, that may not be able to move on to transitional without training, education, those type aspects, which now, as you said, we have this community center, bring in Lynn County Behavioral Health, bring in these resources, and now we might be able to do some real good for some of those individuals.
I just think the intensity of the service that you could provide, if that number is somewhat smaller, is probably higher, right? The degree of service that individual might be able to receive in the community might be higher if there's less people, right? And maybe 30 is the ideal number, and I don't know, but I'm just curious because our community providers out here are very smaller providers.
I absolutely agree with you. The more focus we can bring to individuals, the better. I don't know where that number is, but I do believe that with a consolidated, I think they call it intensive case management. There are a lot of agencies and groups that do case management. Believe it or not, I bet there's 10. You have, Samaritan, they use Epic. It's their hospital system, but they use that. That's their case management. Now, we link into that, not in Epic, but through, their community nursing. When they release someone, we have to, hey, can you go check on? It would be nice if we have, in a sense, intensive case management we can do those things that you prescribe. And I think you're right on with that. The right number, I don't know. I don't have enough experience in that space.
So I have a question. Does everybody that comes into your facility and checks in and is served, do they all get a case manager, or are they just some are
Everybody
independent?
will have a case management file. Now, whether they need case management, you could say, hey, I just lost my job. My girlfriend kicked me out. Do you have a spot? Yeah, we have a spot. We would create a case management with the idea of what services can we provide that person? Well, he's got an ID. He's pretty together. We need to helpfully find him a job. Where do we have a job? We met with an individual. He's in charge of trade unions. Unfortunately, these jobs are in Portland. He says, Brock, I can get you $30 an hour jobs all day long. You just get me someone that is fire barrier, can pass UA or drug and alcohol free. I can get you tons of jobs. So we're in conversation. Is that the panacea? No. Are there jobs around here? No. Do we need to attract more people that can provide jobs? Absolutely.
Quick question for you, Brock. As
Mhm.
we take this before council and the community to build support for it, what are your ideas on basically defining and measuring success for the whole project?
Good point. I did put some success factors, but I think they're more geared from like a family assistance outreach type dynamic, from a case management dynamic, from a community dynamic is, success is, hey, were we able to actually intake someone and help someone of this community obtain, first of all, a place that they can rest, right to rest. Can they do that? We do measure, in fact, how many people do we get to transitional housing? How many people would we get to permanent housing? Those are pretty big aspirations and goals. There are some people going, how many people can I get to court this week? There's some of that too. And so I think there are a lot of measures. I am a big advocate. Believe it or not, I was the chief of staff for the IT department in Hewlett Packard. So we would have upwards of 20,000 projects that would report clear up to the CIO and CEO of Hewlett Packard. And you have to have pretty clear what are success factors, what are goals, and what are measures. And I think we have some initially identified. I think this committee could definitely come up with more. From a law enforcement standpoint, we had 30 calls last year. We have 130 calls for mental illness disturbances. What happens if we now save that police officer having to go out? I'm a little careful with what they call cost avoidance factors. They are real. If I can prevent someone, going to an emergency room and going to, critical care instead, or some other aspects, I can save $1,000 an hour over here versus, a $200 or $300 bill. If I can, get them to court and we can do things, that actually saves money if we can even get them to court versus, okay, now we got to issue a warrant. Now we got to do those things. So I think we've defined a few. I think we have opportunities to define more, and we should seek that input also from the community.
So you made a good point as far as the city as people needing to have more job opportunities for people to be a part of and all that good stuff, which I totally agree. So I feel like, with the mill site property that has just been put up again for auction or whatever, so that piece of property is potentially going to be the area of Sweet Home that now will be able to be developed, provide jobs, provide all of this stuff, yet this piece of property butts right up to that, right? And so how does that really affect the city of Sweet Home as far as you've got this now piece of property that is going to be developed and this is gonna be the draw, you know what I mean? So now we've got this potential pretty big, I don't want to say, for lack of a better word, eyesore. I know that you're saying it's gonna look great, but with homelessness comes a lot of their stuff, and then it gets like brought in, and then it's all piled up and.
Well, okay, managed versus unmanaged. We're gonna have garbage service. We have guidelines, or we have rules in regards to, we're not gonna allow. So we are fighting against a little bit of what you saw this year. And to be honest with you, if I was to say what I saw was a homeless camp on a piece of property to provide a solution that we had at that time. We can't have that. I mean, so as far as garbage and pile up.
We all are like, this is the vision that we have in our head.
I
This
agree.
is what we have seen for the
And
last.
everywhere else where we've seen, I mean, even if you
Yeah.
go to Eugene and look at some of the places that they set up. of
I
course, they
can't
look-
even drive.
Right.
Like, I want to take a different road than I
Yeah.
thought. Not past Mission Street, because this is our state capital.
Yeah.
In fact, when I travel, I don't even like to tell people where I'm from. Spend another 30 minutes answering all the questions about, oh my goodness, you what? You know, you visited.
Well, and I, inadvertently, I've used the term "don't Portland in our sweet home" occasionally, because we don't want that. And it is managed versus unmanaged. It is, there are those dynamics, and yeah, we're gonna probably have just as much battles with that as anyone, but, I guess what I can offer is if you get a chance, take a look at what they call, search Conestoga houses for homeless in Walla Walla. And I think they have some photos. I have some videos that I can post. You look at that operation, there is no paper, no nothing outside of the units. It is orderly. I think if you are able to, that's why I'm a little leery of, if we scale it down and if we do it this way, we could do this. And while you get successes on one end, you do have some possible failures at other ends. And we need to make sure that this is a facility that Sweet Home can be proud of. That people can say, hey, look at what we have as well. And I think we can guard against that. Your question on, well, things change. I was with HP. I watched a division here and I watched it be eliminated. I watched it grow over here. We watched it eliminated. We watched these two guys in a closet develop this thing called inkjet that turned into $100 to $200 billion industry. Things change always, and we should allow the community and the council decide how to best use their resources. So if we had to up and pick up, guess what? If we go with even all the solutions, I could literally take a forklift and go, oh, it's a mile down the way, plop. I could, but it would still need to conform to the requirements that the community wants. It can't be near a school. It needs to be near services. There are some requirements that the city's trying to abate in regards to Martin versus Boise, some of the rules that they can now enforce, no camping. You can't sleep in the doorways. You can be trespassed out of the city, things like that.
I think
For you?
it's we have no way to enforce anything at this point in time as far as where somebody sleep. Everybody has a right to sleep and rest somewhere. Right now, we're encouraging them to go to a certain location over the parking lot by the library, the city hall, with the caveat that, daytime, you need to pack up, you need to head out. I think this goes a long way into providing us a location that, this is an option for you. Right now, we don't mention a lot. We can't keep individuals out of the parks right now if that's where they so chose to go and sleep for the night. And that's a big concern of mine. And so we're encouraging them to go to the city hall parking lot. This does go a long way. And on the concerns of how it's going to, the potential of deterioration, that's been my concern all along.
Mm-hmm.
But I think the big difference is if it's going to be actively managed versus somewhat passively managed. That was the big, in my opinion, that was the downfall of the over the winter, this winter. Yeah, and everybody knows that. And so I've been supportive of FAC, all along to provide us an option. 30, and I'll go back to James. I think 30 is, quite honestly, I've always envisioned it as kind of a stepping stone. Like there's some rewards. You engage in services. There's rewards. There's better housing options. I don't know if that's right or politically correct. I don't know. But right now, I would say, I don't believe we'd have 30 that would fully engage in some services. And I might be wrong, but I don't think there'd be 30 that would fully engage in the services. But those individuals still need to sleep somewhere. And us being able to provide a location that's acceptable, not to everybody, but to as many as we can, I think we'll go a long way.
I think more importantly, my concern is that we would be able to get them out of the other public areas. And now is
That
that
is
something that we would be able to enforce, or is that still something that we would not be able to do. I mean,
Some of that, I believe we could enforce that right now. Now, the city attorney may have some different views, but that's just, he's in risk management. So as we all are. So, he's much more conservative, but I believe we could enforce that.
I also think that we can do dignity both ways.
I
For
think
those
so.
in this situation looking out and being able to pull those who want to pull themselves up, but also for our community looking in, what does that look like? We get to decide what that is. Is it what quality fence, what quality greenery, what kind of space do we want around this that makes it palatable for our community? Because ultimately, if it's not going to happen because our community is going to let us know. Right.
Mhm.
So we have to determine for ourselves what that's going to look like both ways. But we also have this big packet we need to review and make sure that it's palatable for our council and for our community as we move forward, because we're going to have to get their input. And
Yeah,
we're
I
gonna
think
have
we
to have
need
it-
to, I think Dr. Horton even pointed out, we need a summary of that is a little more palatable. Those that want to go into the very details and question things, absolutely. I'm actually very excited you're here. I was hoping that we would get folks, that we could answer questions. And, I don't have all the answers because really, as you pointed out, some of the answers come from you guys. And I think that is exciting actually for this group and this community.
and I'm sure the council is gonna be on this exact same page as the cost is really kind of key on every single aspect. Whether it's,
Continual cost.
yeah, not just the initial
When
upfront.
the grants run out, what's gonna happen? Is it just gonna be?
How many volunteers?
We can't afford to put
Mhm.
people there to manage it, then what's gonna happen? Is it gonna turn into a tent camp, and we don't want that.
Well, then you can dismantle it, but then you're back to facing some of the other issues that we face as a community,
That's been my question too. Do we have a small, medium, large look at things, perspective? Like, I think it might have been you that I met at the gym a couple years ago. My dad has a property, has a shower. He's already like helping people like with taking showers and doing their laundry and stuff. So if there's something like that's something that you guys are already providing somewhere? about-
Well, we're committing a substantial portion of our budget to make sure this happens. We're applying for grants, so another $150,000. We're meeting with grant writers. Now, to be honest with you, until we secure a piece of property, all that's a moot conversation. So maybe I'm not understanding your.
She talked about dignity, and these people are talking about money and the sustainability of it. And so I'm saying, I love a dream, and I'm usually the one to like go right up front and look for the parking space in front, the best possible solution. And the officer here mentioned with all these things in place, how it will run better if you have a better security. Absolutely, but that costs a lot of money. So do we have a small, medium, large aspect of this situation that will work? Do we have a bathhouse where they can do bath and laundry? Do we give them like laundry tickets to do at the facility? That is all helping with dignity. But then is there a medium, something where you could add
The community center,
Phases. Are we talking phases?
could be phases, but I'm talking like with help for these people. Yeah.
It's not just supplying everyone with the house.
For years that they don't wanna go anywhere because they're comfortable.
The beauty of being
So
able
an
to have
8x8
everybody together
right?
Well, that guy lived
is.
2 years, like you said.
Okay,
after watching
so-
it all
Oh, no.
Excuse me, okay, I take the privilege of the chair here. So early on, we determined that one of the benefits of having a facility like this is the different providers, the care providers will have a centralized place to go to be able to render assistance what that individual needs. Some people do need a mailing address. They have a place at this site where otherwise, how are you going to be able to get a job? They're going to be able to have counseling and different things occurring there, and it will save time on both ends because the counselor is not having to hunt down this person that's living in the woods somewhere. And so we're just centralizing everything, which does make sense. And so the people in this room get to determine to a great extent what that looks like. Although our community is going to give us a thumbs up or thumbs down based on what comes out. And so,
I think we're just trying to give them
Yeah.
the idea of what kind of things we're gonna be asking in the community.
yes, exactly. The same questions.
Now, but this is the things that I would come up with. so
Exactly.
that we can-
We have city councilors are going to ask the same questions you're asking.
So that's
Yeah.
what I'm saying. It's like,
Yeah.
it's really big on this, and that's, as he was saying before, even like a 10 or 15 units that where you house 2 people, now you house 30. Is that easier to sustain and have count on 1 person and 1 volunteer, or, you know, maybe the police chief or has somebody that is working nights that could be stationed there and count for that. I don't know what kind of things those are, but those are options that could
Sure.
possibly initially cut down those things that they can throw out there that I would like to hear if I was gonna say, okay, this is gonna cost 300,000 to operate, or it could potentially cost around 80 to 90, you know what I mean? That's a.
Sure.
Just saying, that's what I would, it's numbers, a lot of numbers, and like I said, the scale of that.
Sure. Makes a big difference. Yes.
So when my dad was helping with showers and laundry, I started talking to the people that were coming and going and finding out what their issues are, you know, and a lot of it came down to the residency. Now, most of them had phones, because they had like 3 little Obama phones or something. But apparently there's not like Obama mailing addresses. So, you know, that's a bad name around here. But so my dad was also sharing, you know, allowing them to use the address. And I contacted Lynn County and had a lot of Section 8 papers mailed there and then passed them out to several people. And, you know, just so that they could get that. That was a big breakdown of like, they couldn't get on housing because of the address and stuff. So I guess what I was suggesting is phases or whatever. I mean, can we choose a plan? When you go to get a phone, you choose your plan based on what you can afford. So can we get a couple, you know, like 3 options?
There are some individuals that can afford things. I think I see where you're going with this, and I guess we're approaching it from an operations and facility and location perspective. As far as the services, FAC is outreach. We're a connector to all these services. If you have an individual that needs a phone, we connect them to the phone group. If you have an individual that really wants information on transitional housing, here's our contact for transitional housing. Here's our healthcare. Community court, we're involved with community court. So I wouldn't put a definition on services because we want to provide all those services. We can't provide an address. However, regardless of this project, we're going to probably put a hub in, a resource hub in the city of Sweet Home, just like we're doing in the city of Lebanon, just like we want to do with, right now we have a mobile unit, but we're wanting to have base so that our clients can get the help they need. So I've never done it with services because, to be honest with you, as you mentioned, which I admire, is what do you need? You talk to them, you find out, oh, I need a phone. Oh, I need an address. I don't have ID. Can I get a ride to the dentist? Can I get I need dog food for my pet. That's what we do. So I've never bound that piece because as long as we have all the services available to us, we want to offer that world depending on what that individual needs. So a lot of our conversation has to do with staffing a facility. A lot of our conversation has to do with acquiring a piece of property. And do we have the prerequisites that warrant the county allowing us either to use it, to have it, or whatever? And we're trying to build a good case for doing that. Now, does that case change in 10 years or 5 years if they develop a giant mall there? I suspect, like, I agree with you, things may change. And the good news is this community gets to decide how that changes, and we're adaptable. I mean, the units we're looking at are all, in a sense, portable. We're not looking at a tiny home village. We're not looking at more permanent aspects. There could be permanent components, things like bathrooms. You can turn it into a park. I don't know. you may decide the mill property is better suited as a park for the community. I don't know. It's up to you guys. You guys have that decision.
And I mean, I think fundamentally, this is just a problem that gets worse, not better, without an infrastructure in place. So the idea of building something, I mean, it's huge for the community. I mean, if there isn't something in place, this problem is just going to get worse, right? If this facility existed a year ago, you know, we wouldn't have had the problem over the winter with the tents next to the church. I honestly believe we wouldn't have, right? Not to that capacity at the very least. And so, I mean, if you look at any state, any mayor in any one of those cities, the thing that they're going to wish they would have done, which is build an infrastructure quicker than they did, in order to, you know, to help mitigate the issue.
You nailed it. You know,
because
the
it-
mayor today of Albany said, hey, this isn't a police action or even a Martin versus Boise. It really is a social issue, and how together do we solve a social issue? And you've seen what happens with Portland. I am stunned by that. I am working with a group that they are putting in, I think, 3 to 6 major planned community aspects and stuff, but
So if you had a facility that was already built, already there, that could house 30 people,
I would love it. I don't care what you use as a facility.
because like I have some facilities that were probably big enough to house that many people. Like, would you be able to mitigate a lot of those costs to be able to do something like that?
I put the
I
question
would,
out.
I would insert and say it depends where it's at, because location is huge for this type of endeavor.
Right. yeah.
So it has to meet certain criteria. And so we were actually looking around town for a place that we could find that would meet those needs, those guidelines. And this is how this site was decided upon. But
That's a really good point though, as far as like, so August is like right around the corner, and
Mhm.
this is not going to happen before this winter. In theory, if we're looking at still securing a place, then having to get the funds to put these things in. So either we
Have an alternative?
have an alternative, right, exactly, or what does this winter look like again now?
well, the sub chair is sitting right there.
There's a big issue about COVID too, and what's gonna happen with that. A lot that happened this past winter was because of COVID. Originally, the homeless were going to be going into churches throughout the community,
Right.
and COVID's shut those down. So if we're still facing COVID come this next winter, we could be in the same boat again. If COVID is over and the restrictions aren't 3 feet apart or 6 feet apart, then you can house people in a larger facility. But if the COVID restrictions stay the same, you're gonna need individual space for them. And that, no one has that answer.
But we learned a lot. All
We
of us
learned
learned a lot.
Yeah,
from
well,
this
first of
last-
all, it started off as being totally a minister and her husband, out of the goodness of their heart, providing something for the community that we didn't have. And when the churches all said, we can't do it, I applaud them for stepping up.
Yeah.
They saved probably 1 or 2 deaths.
Mhm.
Because those people would have frozen to death. We had a cold winter. It wasn't as cold as it has been in the past, but it was cold enough to kill people if they had been totally exposed. So yes, it wasn't what we want, but it was what was needed at the time, and we did it. And I think we saved lives by doing it. Do we want to repeat it again? No. And if COVID's not here, I think we will be able to solve it in different ways. Can we get this up and running by November, December? I don't know. If we get that 7, the whole key revolves around, can we get that 7 acres so that we can start to work on it? Can we grade this so that we have rock, gravel that has already been donated to us? If we're ready to put it on, we're ready to do that. Do we have to have electricity, water, and sewer in? No. We could start it with portable potties We've got a portable shower. We have water that can be brought in tanks. We can run something this year if we can't get the structure that we really want. But come wintertime, we can have a place that's a lot better than what we had. But we need the property to do it. Is that going to be a permanent thing? I don't know. But I'm with you. We need a solution before winter.
Mhm.
And I think we can come up with a step one solution, building it. Let's start with the minimum. Let's plan for the next step. Let's get it built if it's a building concept.
Yep.
And let's make it something that we can be proud of, that is going to get the people off the streets, out of the doorways, because they're there. I'm sure all of us have seen them. But dignity is really important. And not all these people are bad. I mean, they're not bad people. They just have bad situations that they're in right now. Can we help them out of it? I think we can if we can get services. The one thing that I was amazed about from the winter camp was the fact that the services, the people that provide the services, according to Sean, they were meeting the people there and working with them and making changes in their lives where in the past they couldn't find them. They were spread out all over town. But at least this way, they were in one central area and they were getting a lot of services that they would not have gotten otherwise. And I know for a fact that it has changed the lives of several of those people that were there this past winter. One of the gentlemen has been homeless for 30 years. He's been in, and now he's saying, I don't want to be homeless anymore. I want help. I'm ready to receive help. And he's getting. And his life is changing right in front of our eyes. So I know it can make a difference. I know that whether it's a Conestoga, whether it's a pallet, whether it's something, if they have a place, if people have a place that they can lock their stuff up, that they are required to keep clean, that they can take a shower, go to the bathroom, get food, get clothing, and maybe get some education, get some ideas on how to improve themselves. That you ask for goals. To me, that's the goal. How do we help them improve themselves, and how do we help clean up our community? Those are the two goals. We help clean up the community, and we help those people clean themselves up. Is it going to be effective for 100%? No. I mean, we're dealing with some pretty tough customers, right? I mean, your father probably could tell stories about the tough customers. So I guess that's where I'm coming from. Let's get this thing going so that we can get the property, we can get it graded, we can get the gravel in there, we can get porta potties, whatever it takes to open this thing up by wintertime so that we're not camping all over town. Because that makes it rough for the police, it makes it rough for the business people, it makes it rough for any business that's coming into town that may want to go on to this new development. They're not going to want to come here if we've got homeless all up and down our streets. That's not what we want either. So let's.
The reason asking too, I think like if we provide this, then do we have more of a grounds to then be able?
Yes, then you can,
Right.
then the police can do what they need to do. But right now, because of the court rulings over the last year, they don't have any teeth
Right.
to move those people.
Absolutely.
And I don't want to say that in a hard way. I know it's a two-way street. We want the streets clean and we want the people to feel better about themselves and to improve themselves. It's a two-way street.
And be safe, things like that.
So I guess I've probably said too much, but to me, that's the two goals.
I'm teaching them too much about talking too much.
So we've had a long discussion about this, and I think it's been a very, very good, beneficial discussion. But we need to move on. This packet piece is what you're going to submit to the council. Or are you going to redo some of
No,
it?
we are going to provide some of the summaries I mentioned, some of the budget ranges. I don't have a service range, but I think it corresponds to what I was declaring the good, better, best when it comes to regards to facilities and operation and some of the things, what were our requirements in that. As far as services, we tried to partner with all the service partners in our organization. And that's our charter, regardless if you have a facility or not. So we're going to keep doing
Okay.
our help for the community. But
So
I think it should be included for those that love detail. And for the others, I do need to summarize some
Okay.
stuff. And I will, I wanted to be able to articulate some of the enforcement possibilities, I wanted to add some pictures, saying, hey, here's a guy just camping. He isn't even homeless. He's got his little, Skidoo, whatever vehicles, water vehicles, and he's just using it as a place to hang out and go to
Okay.
the foster. So
we've got some timelines going, and I know that not everybody here has been able to see this, right? So the homework is for everybody to take this home and go through it
Sure.
as much as we can. Do we want to do it in sections, or do you just want to bite the whole thing and just read the whole thing and come back with notepads and that kind of thing?
I would, we can set up an interim meeting,
Yes.
or my email's always available to folks, or my phone's available to folks. I mean, I want to answer questions, and we need to be able to, I think there was some questions by a couple of your council members that we need to address.
I think we need to do both.
The summarization.
We need to go
of that.
through this, and we also need to have everybody
Yeah.
bring their questions and do it independently as well.
Sure.
So that, because this will take way too long for us to go through every page. If we just hit everybody's
Well, and the
questions will be good.
reality Is we're trying to acquire a piece of property. It's really this 7-person community committee that's really a subcommittee that owns this environment that is going to even probably derive and develop better operational policies than even
Yeah.
what may be described there. So
Okay.
the occupancy requirement, I actually borrowed that from someone else. Theirs was 30 days. But what I kept hearing here is, it should be 60 or no, I said, great. I don't care.
I think when it moves from here to the council, though, we need to have a pretty good review of this.
That'd be great.
And so I think the idea of people being able to call you and ask you questions, coming back with anything that's been red flagged, but also setting up another meeting so that we can meet those timeline goals as we move forward. So there's some meeting dates set here. If we do it all in one, that's awesome. We've been here for an hour and a half, and I think we'll move quicker with the next one. So let's pull two that work for everybody, and then we can always cancel the second one. Does that sound good? All right.
Absolutely. Tell me
So-
what those dates are. And we'll-
Is anybody have a problem with the 2nd of August?
What day is that?
I don't.
It's a Monday.
It's really exciting if nobody has a problem with the 2nd
I
already.
don't-
We are doing awesome. I don't think I've ever been
John
in a
won't be
meeting
there.
that it was that easy. And so August 2nd would be our first meeting. Okay. The day after Jamboree? Oh my gosh, some of you will be tired. Okay, I'm going to take a big leap here. And if it doesn't come out clean, we'll go back to the 2nd, the 4th. Is everybody available on the 4th?
I will commit to both, but I can be available to both, absolutely.
Everybody's okay?
4th.
The 4th? Let's go for the 4th then, because that means everybody will be with us and not dead. And so let's choose the 9th, the 10th, or 11th. Shall we go for the 9th? The sooner, the better for the council. Okay. So the 9th? All right, we've got the 9th. Both.
Both. 4th will be if we don't get, we'll do it, and the 9th if we don't get it done.
And that's
Okay.
here,
And having them close together is probably good, so it's
Yeah.
still fresh in our mind.
and that's here.
Yes.
Okay.
No?
No, I'm okay with that. I just want to ask Brock, is it doable by August 4th? I would like a good week before.
I think, there's some adjustments, whether we'll have everything that everybody wants. I think that'll be through some of the feedback that we get. Again, as I mentioned, there's no way I'm doing a master plan. I can go, and have some guesses at things. I do have a lot of other responsibilities. I know you work through it a lot. I think we can make guesses on some of this as to what we think certain ideals and things are, but.
What I think would be really good is if a week before the 4th, whatever that is, I mean, it's only a week away.
Yeah.
Can you do the summary?
Yeah, I think we need
Because
what they call a project data sheet.
To be honest with you, when I read through this,
It's a policy procedure guide.
I
It's not
I
really
about
meant for-
died.
Yeah.
And I'm very much interested in it.
Yeah, I'm not even that interested.
But I'll
because-
tell you,
yeah.
I'm 71 and I start nodding off after reading this many pages. A 10-page, a 5-page, a 3-page, some kind of a summary.
Yeah.
If
Well,
we
we need
can
a
get a summary of it.
10-page deal, I think could articulate our actions. It may be a little high level, but we should be able to reference or have the details if people really want to look at those details. That's fine.
If you can have it ready by the 4th, then I say let's move forward.
And you can get that to us in time so we can look at it before we meet in this room, because it's really nice
I
to.
think we need to,
Okay.
and, that's what I hear loud and clear, and also, the subcommittee. I will send that out and see, make sure we get that to that team, and, we do have a file share, and if anybody else is interested, I don't mind. I love involvement, so,
Okay.
if you'd like to be included and involved, just, we can send me an email, you can figure out how to get a hold of me. I love that participation, absolutely.
Okay. I don't believe we have any old business. Is there any new business that anybody wants to bring up? Let's do a quick around the room and to respect everybody's time, because we have been here for a while. Sean, do you have anything to report? Okay. Larry,
I've said way too much.
anything else?
Wait,
Barbara,
wait,
Brock?
pass.
Okay. Okay. You guys?
This will actually be my last meeting.
What? We can't have that.
I'm sorry.
You can volunteer, James.
Huh?
You can volunteer and come back.
I could. I could.
I'll write you a grant. How much do you
You
need?
give me a grant, I'll be out there.
So are you going somewhere else? Is somebody going to come in where you're at? What's happening here?
I don't know what they're gonna do with where I'm at. I'm going, somewhere else, outside of Samaritan. So, it's my last meeting. So I'll miss you all. Thank you for
I can
having
say
me.
you can volunteer.
Could.
Are you staying in the
We could
area?
work you into a
Are
position.
you gonna be in this area?
We
I
love
will-
experienced people.
No, I'll be in Albany, actually.
Oh, well,
Well, it's been good having you with us.
it has been.
And
I am
we
trying
wish you
my
the best.
To get someone out here. I'm not sure exactly what they're doing with my position yet. So if I do hear of that beforehand and before I go, I'll let them know that, and I have already, but, I'm not sure what's happening.
Well, thank you for letting us know.
Absolutely.
Dick,
Thanks for
do you have
being part
anything
of
else?
this, too.
I'm fine, thank you. Good
Thank you.
meeting.
Bob?
I mean, I could spend another couple hours after all the notes I've taken, but, this is a big project. And my only concern with this size of a project, it's too big. And you'll get stalled trying to do all of the above. I think I agree with the person in the back, the 1-phase, 2-phase, 3-phase approach. Because initially we were with a cold shelter and that was our initial goal, was to get people off the street from freezing to death. And we weren't at that time talking about transitional housing. And to me, if our initial goal is to get the property and get a cold shelter place for people to land as a start, I think that's a good first step in my thinking of this. And then the more information is gathered, the more input. Phase 2 comes along, phase 3 comes along. So we know that we've got the funding, we've got the support of the community. Large document, Brock, you know, I'm the one that has thrown a lot of questions at this thing just
Absolutely.
because of the size of it.
Yeah.
When I first started reading it, I was like trying to keep my eyes open because there was so much data in here. So when I talk about being brief, I'm really leaning towards, you know, a 2 or 3 page versus a 10 page is taking the key factors out of this and drilling it down to Sweet Home specific. To me, this plan right here looks like something you want to run a corporation with.
It is, yeah. No,
And-
it's a very detailed,
And I look at that 2 or 3 sheet document, this being the support backbone of that document, but not the documents for Sweet Home. And I talked a lot with Ray Towery as well, and you know, his concern too was that the questions is how do we take care of the individuals that are out there on the street? How do we keep them safe? How do we keep the community safe? Those types of questions, the cleanliness, the sanitation, the infrastructure, the water, the sewer, those are all questions that we talked about tonight.
yeah.
And again, I guess the question we have to walk away with, what's the humane thing to do? Is it to turn our backs and do nothing and have the same results, or put our backbone in it and make it happen? You know, my wife and I, we attend church. I guess the one thing that come to thinking when we're dealing with people that are in homeless situations or living on the streets, those are our modern day lepers out there. And we can't leave them in the ditch.
Yep.
And that's to Larry's point. It's our ownership and responsibility to pick these people up. I mean, we treat our pets better than we do the individuals on the street most of the time. And we need to change that. So I think the long-term goals and short-term goals are some separate things. I think Ray and I talked to that we didn't want to make this facility a long-term site for someone, that they didn't come there and stay 1 year, 2 years, 3 years. We want to get them through the system. And part of that goes back to what are the services that can get them through the system? Because I've worked with a lot of different services, and you can only process so many people through the system, and pretty soon you start getting this backload of, they just get backed up.
Transitional.
And housing is one of the biggest things
Yep.
that I came across with them is I worked with an individual, a group, and, you know, the individual got a job, they got themselves back in school, got the little girls taken care of, housing become the next issue. And again, if you look at housing in Oregon, it's stacked up. You know, there's just not that affordable housing piece of it. And I think Larry's point too, COVID's not done. And Lynn County has one of the lowest vaccinated rates in the state. And that's going to play, I think, a big factor, especially with this variant that's coming along. We don't know what that's going to look like. And I think, you know, a cold shelter, one location would have been a great deal for us. But that world's changed. And that's going to be something that is going to be hard to handle and take care of and make it fit in all the time. So the challenge is in front of us, but I think we've got the good people in this room that can make that happen. So
And I think
support it.
you have some good ideas, and I'm happy to meet with you later this week if you'd like. And we can reflect, and I can get that proposal into the shape that, at least from your conversations and such, that we can meet, you know, more in tune with what your requirement is.
Yeah. Okay.
Absolutely.
I think good job on everybody's part. I'm glad to see the group here.
Yeah.
Because that's who we need to hear from.
Absolutely.
They're concerned. I think aesthetically, this development could be made to fit in to the community without the concern of it looking like the church did. And that was one of
No,
Ray's big,
that-
that was one of Ray's
Yeah.
comments to me. We can't allow it to become another church system.
No.
But it's what we had to do at the time, and we did the best we could with the resources we had, and God bless those people for stepping up and doing that. So,
Yeah.
Good process. So,
Thank you.
See, real quick, yes.
I've worked at a facility, like, you know, we're there helping people. I guess my feeling sometimes was the salaries of the people that were there were most, I mean, they were benefiting a lot from that. So you mentioned the 200,000 or whatever. First, I was kind of like, oh, that's a little negative. Well, I'm gonna like, this is kind of negative too. So it's just that sometimes people are gonna stay homeless. It's a choice that they just want to stay. They want to do that. They want the free help, and then and love changes that, you know. But sometimes like the salary can get out of hand. My question is, on that lower end scale, how many people would donate their time and provide some type of services, do an intake, something kind of like a food bank? A lot of times you're checking, you know, how many people, how many times they come in, so that kind of thing, and helping with resources, but maybe they're not paid. So this is like the lower.
I'm not paid.
That's how we've been functioning. That's how we've been functioning, with just running on heart pressure. That's it. And so, but that's another phase. We just got to get something on the ground to start with. And so there has been a lot of warming shelters and different things over time. And so it's time for us to progress as a community. So with that, there is no further business before us. I would entertain a motion to adjourn. Do we have a second? We have a first and a second. All those in favor? Any opposed? Motion passes. Thank you. Thank you, everyone, for being here tonight. This has been great.
Thank you. Stay well.